My name is Victor Moran, and Chelsea is my patient today. I'm going to be doing a series of orthopedic tests and measures on her. So the tests that I'll be doing today will be lumbar active range of motion flexion with inclinometer, hip external rotation contractile unit testing, mobility testing of the lumbar spine using central PA pressure, joint mobilization of the hip inferior glide grades 1 through 4, and the FAIR test. So I'm going to start first with the lumbar active range of motion with the inclinometer, and I'll ask Chelsea if she can please remove her shirt. And Chelsea, if you can turn and face that wall, I'm going to first locate Chelsea's PSIS. And make a mark there. And Chelsea, I'm just going to roll your short down just one notch if that's okay with you.
That's fine.
Okay. And I will mark 15 centimeters above the initial line. Alright, Chelsea, I'm just going to roll up the bottom of your sports bra if that is alright with you.
No problem.
Thank you. So to start with lumbar flexion, I'm going to instruct Chelsea to please bend over and touch your toes, keeping your legs straight. Good. And I'm going to take my inclinometer, put it at the first line, and mark it to 0. And then move it over to my second line. And the reading on this inclinometer is 20 degrees of lumbar flexion. You can stand back up. Seems a little low. Second testing that we're going to do, and Chelsea, you can leave your shirt off for me, please, for when we do the other ones.
Okay.
We're going to be doing the contractile unit testing for hip external rotation.
Okay.
So if you can lay face down on the table, please. For this test, I'm going to measure light resistance with external rotation, asking the patient if any of my motions or any of my resistance reproduces her symptoms. So Chelsea, I'm going to start out with this leg here. So Chelsea, what I'm going to do is I'm going to try to push your leg away from into you this way, and I want you to not let me move you. As I'm doing this for 5 seconds, I'll have her match my resistance and gradually ease off. And did that reproduce any of your symptoms?
No.
Now, same for the opposite side. Chelsea, I want you to gradually meet my resistance and don't let me move you. Let me know if this reproduces any of your symptoms. So go ahead and don't let me move you. Good. 5, 4, 3, 2, and gradually. Good. Do you have any reproduction of your symptoms with those?
No.
So her contractile unit testing results are strong and painless. So there would actually be no need to do an MFT after this. Third, I'm going to do her lumbar central PA, joint mobility testing. So what I'll do here is I'm going to pick out a lumbar segment and locate the spinous process. I'm just going to roll your short down right here. Short center line of the room. And once I locate the segment that is having issues, I'm going to apply a posterior to anterior force just to assess her joint mobility, not going really to the end range, but just kind of getting a guide for how far I'm going to go. Should probably just get on this side of the camera. It's a little bit better. Now that I've located her spinous process, I'm going to slowly, gently ease into the range of motion of her lumbar vertebrae accessory motion until I feel close to what I would think is end range, but not pushing through that. Just making sure that your pressure is going onto the spinous process, not in between the spinous processes. So now that I've assessed her motion, I'm going to do mobilization grades 1 through 4. So starting with a grade 1, I'm going to go to 0 to 25% of her available motion that I assessed previously. Now a grade 2, in which I go from 25 to 50% of her available motion. Progressing to a grade 3, which is 50 to 100% of the motion. And always asking the patient if this reproduces any of their symptoms or is it tender. And Chelsea, are you feeling any pain, reproduction of your symptoms?
No.
And finally, a grade 4, which will be moving through the last 25% of her motion, or if you would like to call it 75 to 100% of the available motion, doing slightly quicker amplitude movements. All right, so that's her lumbar central PA pressure, and everything checked out, no pain, no reproduction, good. Now, you just relax there for a moment. And can I please have you lay face up for me? Sure. So I'm going to be assessing Chelsea's inferior glide at the hip. And to do that, smooth the table down just a little bit. So Chelsea, what I'm going to be doing today, I'm going to be bringing your hip straight back toward me. And I want you to let me know if you have any reproduction of your symptoms. And also what I would like for you to do is to please guard yourself, kind of private area where you would not like me to touch.
Okay.
So I'm going to bring her hip to about 90 degrees. Bring her knee over my shoulder. And I'm going to move gradually toward the joint line. And as I ease into the motion, I'm going to provide a straight inferior force, doing a slight scooping and then pure inferior force. Assessing the motion. Is any of this reproducing your symptoms?
No.
So now I'm going to go through grades 1 through 4 for this as well. So as I explained before, the percentages, right now I'm doing a grade 1. See this small movement. Grade 2. Grade 3. And last, grade 4. I could do this bilaterally, I suppose. Oh, I see, I didn't have to do the grades for the lumbar central. And assessing the same motion here. And again, always checking with the patient to see if you reproduce any of their symptoms. And now moving through grades 1 through 4 again. And lastly, we're going to be doing the FAIR test, which can test for piriformis issues here. So for the FAIR test, flexion, adduction, and internal rotation. So I'll bring the patient into flexion here, bring her into adduction, and internally rotate. So I'm actually doing the FADIR test right now. So what I'm actually going to do is ask my patient to lie on her side. Can you please lay on your left side, Chelsea? Instead, you can bend your bottom leg so that you feel more stable on the table. Actually, keep it straight, please. I lied. Bring her into the hip flexion here, adduction, and now internal rotation. Okay, cool. May I please have you scoot more toward the edge of the table for me, please? Now, for the fair test that you've all been waiting for. I can stabilize here at the hip so that she doesn't get much rotation, so I can actually assess the piriformis here. And if you feel any reproduction of your symptoms, do let me know. So I first let her drop and then apply a slight inferior pressure there. And no reproduction of your symptoms?
Nope.
Good. We can bring her back up here. And now I'll have you lay on your right side for me, please, facing me. And right there at the edge of the table for me. Good. And doing the same here, bringing her into hip flexion, adduction, and letting her go slightly into adduction with gravity and internal rotation. So I'm going to go ahead and push her into that internal rotation and stabilizing at the hip. And does this reproduce any of your symptoms?
Yes.
It does. So could you show me where this reproduces your symptoms as well?
Okay.
So those two are consistent with a positive FAIR test. We could assess the piriformis in other manners, whether it be strength testing and or doing any kind of neural testing and trigger point palpation, that kind of thing.